what we tried to do then is incorporate every best practice, including health coaching, medication management compliance, telehealth, chronic disease management. But probably the most unique component is the medication compliance. If a patient is identified at high risk for rehospitalization, and quite honestly, most of the patients that are admitted to the hospital these days are at high risk to go back in. And so we have incorporated a pharmacist consultation piece that's part of our home health program also.
It was probably about 2 years ago that we actually started looking at how do we take our traditional methodologies of long-term care pharmacy and move them and adopt them to taking care of patients at home. Maybe 2% of patients can really even take their medications appropriately. So we get away from the traditional amber vial. We move over to a system that is basically organizes your medications into a pouch by day, by time, by date. And you have multiple medications that are then organized into a morning, a noon, a bedtime pass, where the patient doesn't really have to think about anything. They basically just tear their strip, open the pouch, and take their medication. So it's a lot of stress off of having to organize medications. Also a big burden off of caregivers, family members that have to also manage their medications for their loved ones. I guess an assistance, or make it a lot easier for the nurses in the home to pass the meds.